Hi, my name is Seyye-Kalantari, and in this short lecture, we are going to talk about the fairness of AI-based medical image classifiers. By the end of this talk, you will learn what are AI-based medical image classifiers, how do we measure fairness, if these classifiers are fair or not with respect to underdiagnosis, and also why lack of fairness is important. AI-based medical image classifiers are trained to yield diagnostic labels from medical images. The standard approach for training in this model is to train them on overall population and optimize them to have a high performance average across all patients in the dataset. We follow this standard approach and reach the state-of-the-art performance in three large public chest X-ray datasets. That's the point that usually the researchers stop and they report their performance. However, the overall population is a mix of patients from different races, ages, sexes, and also different social economic status. And we want to make sure that all those patients have equality of opportunity in correct disease diagnosis, regardless of their membership to this subpopulation. That's why we think this is not a good stop point, and we think that we need to do fairness check. How do we measure the fairness of AI model? So depends on the problem that you are working and the data set that you are analyzing. There are a number of ways that you can define your fairness matrix and also the attributes that you want to consider to check the fairness of your model with respect to them. One of the famous one is equality of opportunity, for example, which is trying to make sure that people who are belonging to different subpopulation, for example, subpopulation 0 or subpopulation 1, both of them has equality of opportunity or equal probability of getting true positive rate. And that's one type of defining a fairness and investigating in your data set if this condition is satisfied or not. For instance, in medical image classifier, we were interested in underdiagnosis rate. Underdiagnosis rate is false positive rate in no finding. It means that the patient has a disease, but the classifier report the patient as healthy. Therefore, the patient will not receive the treatment in a timely manner. And you can imagine if you have such a system in a triage where it doesn't have equality of opportunity and underdiagnosis for all patients, it would be harmful for those patients who are having higher underdiagnosis rate. We check underdiagnosis rate in different sexes, races, ages, and also insurance type. And we were using insurance type as a proxy for social economic status of the patient. Here you can see the distribution of underdiagnosis rate over different subpopulation in our test set. On our test set, we have trained a model on mimic CXR data set, and it has a very high performance average across all patients. But it seems that it do very well for overall population, but it do much worse for some specific subpopulation. And surprisingly, the patients who are belonging to historically underserved subpopulations, such as female, younger patient, Black patient, and patient with Medicaid insurance who are often low income, they have higher underdiagnosis rate compared to the other patients. We look into the intersectional identities and see that if one patient belongs to more than one underserved subpopulation, such as Hispanic female, they are having higher underdiagnosis rate compared to, for example, white female. So we were wondering why this is happening. To answer this question, we check if AI model can detect the patient race from medical images. And surprisingly, across different data sets and different imaging modalities, they were able to find the race of the patient just by looking at medical images with a very high performance. Therefore, we are in a situation that AI model not only can detect the patient race from medical images, but also behave against historically underserved races. That's a very critical issue because those patients may not get treatment in a timely manner if we deploy these models in practice. And this type of barriers should be addressed before deployment of these models in practice.